Hello, my name is Kathy Farrell. I've been a nurse for 37 years. The past 15 years I've spent in gerontology, which is the practice of caring for the aged. My most recent experience has been in home care, and I'm a big advocate of home care because I believe most of the elderly would like to age in place in a familiar environment with mementos and objects, and in the comfort of what they believe is at safe at home. There are 4 areas that I'd like to discuss with you. These are some of the areas that, as a nurse, when we first do an assessment in the home, we look at these 4 areas to determine how much the individual is at risk. And certainly that's an important aspect, because if you can identify some risks, then you can put some pieces into place so that you can minimize injury and or minimize the risk. The 4 areas that I'd like to review with you is first the physical, the emotional, the social, and then certainly the mental, or the mental health of the individual. What I always look at is asking the important question as to whether or not the elderly person is experiencing any fear, or if they have any issues that they're fearful of in the home. The most important question I usually ask an elderly person is whether or not what their concerns are. What are they concerned about? I think it helps to point out where they have a general sense of insecurity and or they're ill at ease. In the physical sense, what we look at is whether or not the individual has any pre-existing chronic disease. Sometimes that makes management of them in the home a bit more difficult, but it's certainly manageable. We also look at things like their functional status. And when I say functional status, I mean, are they able to ambulate? Is it necessary for them to have an assistive device? If they need an assisted device, such as a cane or a walker, do they currently have one available to them? Is the home free of obstructions when they're walking? For example, if they're walking from their living room to their bathroom, are there, throw carpets or curled edges of inlaid linoleum? Is there enough space, if they have a walker, to get through the doorway? Or if they happen to use a wheelchair, can the wheelchair fit through the doorway so they can get into a bathroom? The other thing is, if they're making their own meals, whether or not they have fully functioning systems so that they can safely cook on a stove, reach for dishes, remove items from a cupboard. Does their physical abilities, are they such that they can safely perform those tasks? It's really important to be able to identify the functional status, because if an individual is fully functioning, they can ambulate, they're probably less at risk than someone who has functional limitations. Sometimes an individual doesn't necessarily have, maybe they're not stricken with arthritis, but sometimes pain and the mismanagement of pain can lead to poorly functional status. So that might be something you might want to consider as well. The overall functional status, usually you're able to identify how much risk is involved in terms of injury. Very often we find that if someone has fallen and fractured a hip, it was probably related to either a carpet that was in the way, or maybe it was an animal that was in the way, either a dog or a cat. So these are issues that are really important. We don't like to really change the environment because it is the individual's home, but what we do like to do is to minimize the risk. And very often home health nurses are involved in doing that, as well as physical therapists and occupational therapists. The other areas that are really important as far as physical is whether the individual takes any medications, and if the medications are easily available for them, if they know what the medications are for, and certainly whether or not there is financial capability so that they can purchase their medications. There are many different systems that home health nurses use so that the administration of their medications, the self-administration of their medications, is done safely. For example, there are small, what is called medisets. They have these containers and they're labeled for the days of the week and also times of the day. And sometimes you can set those up on a weekly basis. It also helps you to gain insight and understand whether or not there is medication compliance. Very often, if we see a client a couple of times a week and we notice that pills are mixed up, or maybe pills haven't been taken, or maybe too many pills have been taken, it helps us to understand that maybe there's a problem with self-administration of medications. So that's an important issue. It's also a very important issue in terms of management of pain as well as chronic disease. The other two physical areas, or the areas within the physical realm that we look at, is hydration and nutrition. There are a lot of issues for the elderly with respect to hydration. Very often they tend to minimize fluid intake because that means another trip to the bathroom. And so also in the aging process, physiologically, there is a diminished response for thirst. And so what we often do is, measure out 8 ounces in a container and ask them to drink, 4 or 5 of those a day. Many of the elderly like to take hot liquids even in the summer, and that certainly accounts for adequate hydration. Excessive caffeine, however, tends to dehydrate the elderly person. And the same is true not only for tea and coffee, but also sometimes for soft drinks like Coke and high caffeine drinks. The self-administering of medications is really important because currently in the United States, 1 out of 6 admissions to the hospital are generally related to either overdosing or underdosing on medications. So I can't really stress this enough. If you have the responsibility of looking after an elderly person, certainly you need to engage not only your physician but also the pharmacy. The pharmacy that dispenses the medication is just invaluable as far as side effects, dosing, also interactions of medications. They can give you a heads up so that the individual doesn't experience unnecessary side effects. So I can't really stress that enough. That's a really important component in caring for an elderly person. With respect to hydration, it's really important that the elderly individual, especially an individual who is on a lot of cardiac medications, that they're well hydrated. Sometimes individuals can become toxic if they are dehydrated. It also can lead to a lot of dizziness. Dehydration leads to a lot of dizziness and a lot of fatigue. So sometimes it's a simple matter of hydrating the individual well enough so that they can improve their overall feeling of well-being. On the nutrition side, there are a lot of things to consider. When we look at the general nutrition of an individual, We, of course, always look at first whether or not they have any specialized diets. There's lots of resources in communities with respect to dietitians that are available in hospitals. There are lots of community health programs where individuals can actually attend classes to learn about special diets. And many diseases, chronic diseases, are managed with specialized diets. So if an individual has, for example, a low salt diet, a low fat diet, maybe a low sugar or carbohydrate diet, all those things are important to understand and know about. When considering nutrition, the biggest issue is, I believe, for most elderly individuals, is they often eat alone. And so there's an absence of the social aspect of eating and engaging in conversation. I know that many elderly buy prepackaged foods, and they also buy a lot of prepackaged frozen foods. But if they're on a special diet, particularly a low sodium diet, you need to learn how to read the labels and make certain that the content of the food is not restricted in their diet. So when home health nurses are doing an assessment for nutrition, very often they ask the individual, what do you have for breakfast? Generally, breakfast is their largest meal or a big meal. The other thing to consider is whether or not the individual is able to cook. Functionally, are they able to prepare meals? Many communities have community services such as Meals on Wheels, or community outreach so that meals are delivered to elderly in their home. If you're caring for an elderly individual, it is so easy to just prepare meals at home, freeze them, and just have them in the freezer and ready for them to either heat on the stove and or heat up in a microwave. The nutritional aspects are so important because very often, the body continues to need adequate protein, adequate fat, adequate carbohydrates, even in the aging process. And I think sometimes the nutritional aspect for the individual is overlooked, mostly because they're isolated, and so they tend not to engage and actually prepare meals for themselves. The one thing that we're always concerned about with the elderly is weight loss, and so sometimes weight loss is an indication that there isn't adequate nutrition. It can also mean many other things, but just having a scale available and weighing the individual on a weekly basis, we often look for the risk factor that is probably more than 5 pounds of weight loss in a 30-day period. So in thinking about the physical aspects of the aging individual, it's important to think about their general well-being, whether or not there's a presence of chronic disease, their hydration, and certainly their nutrition, and then also their functional limitations, if any, which very often will put the individual at risk. The next area that I'd like to discuss with you has to do with the emotional component. A lot of folks kind of minimize this particular area in the aging process. I tend to focus on this a lot. I had a great deal of experience on an inpatient mental health unit for the elderly. It's called gerontology, and it has to do with dealing with mental health for individuals over 65. And I learned there very early that there are emotional components for the elderly just like there are for all of us. And so it's important that you have a conversation with the individual, and I certainly have conversations with my clients about their emotional well-being. How well are they doing? What is their general outlook? Are they crying? Are they not sleeping? Do they tend to become anxious when they're left alone? Do they tend to become anxious in new situations? So all of those things really contribute to their overall emotional well-being. I ask the individual how well they're doing with respect to where they are in their life right now. And very often individuals will respond by saying, "Oh, I'm just getting old. I'm just old. That's all." And so I ask them how they feel about that, and whether or not they ever felt like they'd live to be, 90 or 92 years old. Much of this information has to do with frail elders in the home. And so it's important to have an understanding about their emotional well-being. I find that clients who are straining in terms of their emotions either are also straining with the concept of end-of-life issues, and or maybe there's a strain within the family in terms of relationship. And so I will always ask them, who's the most important individual in their life right now, and is that person present? Is that person available to them? I also will ask them if when they've had difficulties in their life in the past, how did they cope? What did they do? If you begin to point out for an individual how they've coped with difficulties in the past, they can very often use those coping mechanisms to cope in the current situation. I do believe that there is a lot of issues around isolation and loneliness with elders. If they're in their home and they're alone and they have infrequent visits, the days become very long, and so it can lead to a boredom. It can lead to feelings of isolation as well as loneliness. The other aspect that I very often will coach a client is life review, whether that's through old photographs or important events in their life, so that they can focus on the memory of what they believed was the most important aspects of their life. Sometimes I'll ask about photographs in the home, but if you're caring for an elderly person, it is so valuable to just sit and visit and really take the time to talk about life events. Grandma, what happened then? What was it like when you were a young girl? Or all those things we call them reminiscing, and it helps to bring back good feeling in those memories for their life, and helps to remind them the importance of their life. The other aspect that I believe is also very important is whether or not there's in the emotional component is whether or not there's a component of depression. If it's serious, it really needs a visit to the physician. Very often depression is minimized or may not even be acknowledged. So I've seen many patients with mild to moderate depression, some patients with severe depression, so that it can be a problem in the elderly if it goes unrecognized. The other area that I'd like to talk about is the social aspect of the aging person's life. The social component helps to engage them in activities which they like to do. It may be by themselves, it may be with other people. If you're caring for an elderly person, I can't stress enough outings and how important that is. If they belong to a church or a social group, or they have a network of friends that they like to play cards with or visit with, all those activities help to enhance their self-esteem, which overall improves their well-being. Again, the social aspects go back to the environment and whether or not that individual has frequent visitors, whether they are able to get out of the home themselves versus someone who is what we call homebound, who cannot. A homebound individual typically is defined as someone who can't leave the home without attendance. Those are the individuals that we see quite frequently in home health. I mean, part of the reason that the Medicare benefit is so significant, it allows for professionals such as nurses, physical therapists, occupational therapists, even home care aides that can go into the home and assist an individual either with personal care or professional assessment. And so the social aspect is really important. I maintain that if an individual was not a social person in their life, it probably is unlikely that they'll become one at 85 or 90 years old. And so I generally make an inquiry to find out from them what their social life was like. Did they belong to clubs? Were they always active and just recently became inactive? And I try to find their areas of interest so that I can make some good suggestions for them so that they can engage and still continue to experience pleasurable activities in which they can gain improved self-esteem. We've talked about the physical, we've talked about the emotional and the social, and now I'd like to move on to mental health issues. I briefly touched on depression. The thing that I find that most people become anxious about is memory, and whether or not a memory loss problem exists. If you think about it yourself, when you're stressed, you can't find your keys, you can't remember where your checkbook is, you can't, where's the dog? Stress will induce forgetfulness. Stress will also induce some memory loss. When I was a clinical manager for an inpatient geropsych unit, we had many patients who were admitted for memory loss. Either they couldn't fully function. There are lots of areas to consider when you look at memory loss in the elderly, but it is a logical process that we go through, and much of that process includes observation. You can't make a determination on a single event. If grandma can't seem to find her purse, or she can't remember what she did with her pills, or it may be stress-induced. It may just be that she needs more time to manage those tasks. It may not necessarily mean Alzheimer's. We do know that there is a significant incidence or increase in incidence with memory problems in individuals over 80. And then when it goes from 85 to 90, there's once again an increase. Memory loss does not always mean Alzheimer's. There are many, many different types of dementia. Alzheimer's is the most common. However, there are dementias that are caused from injury. There are dementias that are caused from inadequate vascular function, and so we need to be careful not to label someone with Alzheimer's if that currently isn't not the case. I also need to let you know that sometimes with the management of pain medication, an individual may be overdosing their medication, which can also lead to memory loss. And sleep patterns can sometimes lead to memory loss. They're just, basically exhausted. So before you jump to conclusions with respect to memory loss and then the ultimate jump next to Alzheimer's, you really need to spend quite a bit of time in different situations with the individual to try to make an assessment. In home health, we actually are able to do what is called a mini mental. It's not a conclusive test, but it certainly is a good screen that looks at verbalization. It looks at calculation. Can the individual do math? It looks at abstract and reasoning. It also looks at memory as far as recall. Can they recall objects? And then the other area that it often looks at is judgment. Certainly if someone is showing an impaired judgment, or judgment that's impaired in such a way so that it puts them more at risk, then memory may be an issue for them. The thing that I want you to remember is that, there is such a thing as benign forgetfulness, where people just inadvertently forget, or they just can't quite remember. It doesn't therefore follow that the individual has a serious dementia. So don't jump to conclusions with that. An individual needs, the thought process is slowed in aging, and so they need more time very often to engage in the conversation or follow the conversation. And so you need to treat them with respect and certainly have a great deal of patience in that area. The management of a dementia client in the home is complex. What I would like to suggest to you is ways and techniques that you can use for simple reminders if someone is experiencing forgetfulness or some lapse in memory. Calendars are great. What I've seen individuals do is use cutouts from magazines with just kind of like a star, a highlight, where you kind of look at what's important on a date. If an individual has a physician appointment, write it down. An appointment book is very good. The one thing that is really helpful is the organization of important phone numbers, for example, so that those phone numbers are readily available in the event that someone needs to make a call, either to a friend or a neighbor. Organizing their paperwork, for example, if they're managing their own checkbooks, or their checkbook or their finances, do they have those items organized, and is it in a place so that they can keep it contained? So any areas in which you can help the individual to either organize information or financial books or phone numbers, those things are really important, so that it tends to minimize disorder and makes for more orderly and less forgetfulness. I go back to what I said earlier, and that is I often will ask the individual if they have any concerns. And very often I ask the question of, do you have any concerns about your memory? Do you feel like you're safe? Are you able to function? And very often that leads to a conversation to what they're concerned about. And it can really be as simple as that. So we've talked about the physical, the emotional, the social, the mental well-being of the individual. I'd like to give you some guidelines for some what we call early warning signs. Things that kind of set out some red flags that you need to be aware of. And I would also say that if these things are occurring, you really should contact the individual's physician, because they generally are indicative of more serious problems, or they could be serious problems. And that is, the first thing is weight loss. If you're checking their weights and keeping a record of their weight, and you can do that on a weekly basis, you can jot it down in a calendar, or on a calendar. If there is more than 5 pound weight loss, if there is more than 5 pounds of weight loss in a 30-day period, I would say that that's a significant warning sign. If the individual is having falls, very often the elderly won't tell you they're having falls. You may notice that they have a scrape, or maybe suddenly they have a Band-Aid on their arm, or you need to ask them about that. Have you had any falls? How often are you falling? Where are you falling? How are you falling? And whether or not the falls are resulting in any injuries. Sometimes the elderly experience balance problems, and so it makes them more susceptible to falls. Certainly any falls that result in injuries should be reviewed by the physician. The other thing is any really noticeable withdrawal. I'm not suggesting that you've invited them out for an evening and they just decide they don't want to go. I'm talking about a situation where there was continued withdrawal, where the individual was somewhat engaged either socially and certainly emotionally, and now suddenly they've somewhat isolated themselves and contained themselves. That sometimes is a very early warning sign for depression and some other issues. The other early warning sign that is important is a sense of hopelessness. Just this general conversation or overtone most of the time where it's hopeless. And hopelessness can very often lead to depression. In those thought patterns, it very often leads to depression. So if suddenly someone has been, bright and cheery, and all of a sudden there's this realm of hopelessness, I would say that that's an early warning sign as well. The other early warning sign that I view is non-compliance to medications. We talked about medications earlier. If the individual is self-medicating, they're not using a Mediset, they're just taking their pills out of the bottle and dispensing it to themselves or administering it to themselves, it may be more difficult to be able to monitor whether or not they're compliant with their meds. But generally, non-compliance to medications is a warning sign. It often leads to the discovery that there are, financial difficulties. But individuals sometimes are not compliant with their meds for very different reasons. So these things, the falls, the withdrawal, certainly the weight loss, and then non-compliance with medications, and or any type of injuries with falls, lead one to believe that it probably needs attention. I've talked several times about home health, and I can't stress enough. I just have a really strong belief about home health and the value of those professionals in your home. Having been case manager in home health as well as a manager of home health nurses in a couple of different settings, I cannot stress enough the value of that service. What is very important is if you have the benefit of home health services in your home, I strongly encourage you to engage with those professionals in terms of relationships. There is a variety of professionals that are available through home health. There are certainly nurses, there are home care aides or home health aides that can provide personal care for the individual. There are physical therapists, there are occupational therapists, speech therapists, there are social workers. Pharmacists now can do visits if the home health agency happens to have a pharmacist on staff. They can actually do visits as well. And so there's just a variety of professionals that sometimes can be overwhelming in the home, but each of them have their expertise, and the important thing is that they work as a team for the benefit of the aging person. Under the Medicare benefit, home health is available as part of the benefit under Medicare. There is a requirement. I'm a strong advocate of home health. I just see the benefit and have certainly seen the value of providing that care in the home. Under the Medicare benefit, a physician's order is required. And so if you think that an individual is homebound and they need some more care, they need more assessment from professionals, I would encourage you to contact your physician and ask them to make a referral to a home health agency in your community.